I'm again discussing a recall history that is comes on Jeddah 2019. That is 5 years old girl, Fanconi anemia with a plastic anemia with multiple bruises and failure to thrive, and childhood learning difficulties with deafness. Family history and consanguinity positive. So that is a Fanconi anemia history. The features in our case, task the problem was there is multiple bruises. Child is anemic, like pallor. Then failure to thrive, not growing well, and on history, finding learning difficulty that is definite and family history of consanguinity. Normally, Fanconi anemia feature we know that they are short in structures. They have absent or hypoplastic thumb, short stature, low set ears and deafness present, strabismus, skin hypopigmentation, renal abnormality. So deafness, when we ask that any hearing concern, they will tell deafness. Structure is development is growing like pears, then short stature we find. Any unusual features we ask, then we find there is hypoplastic thumb or absent thumb, and these are. And also Fanconi anemia, they have a predisposition of increased risk of acute myeloblastic leukemia, solid tumors, and aplastic anemia. So all the features of bleeding, bruising, these are present. Leukemia features present. So tummy distension can be present. Now I'm telling you how can we take the history of Fanconi anemia. First, the chief complaint that is onset, course, and duration. How long is suffering this condition, when it first started, and is there anything triggering factor? Is there anything make better, anything make worse? Then hookup. That is the problem is first time occur or recurrent occur. Is it preceded by any illness, fevers, any other concern, any dysmorphism like unusual features, and the child is suffering any chronic disease? Then generally ask about the FWSL, that is fever, weight, activity, sleep is affected or not. Then we are going for the systemic review from MSK. We are asking, is there any skin spot, scapulate spot present or not, lump, neck swelling and other lump in the body, bone pain, deformity, fracture, hair, nail and teeth. So these are we are asking, is there any bone pain, deformity in the bone, capulate spot? Then CNS, we ask increase intracranial pressure sign, abnormal movement, abnormal behavior, abnormal gait, face asymmetry, vision concern, deviation of the eye, speech, any concern regarding hearing. Then from chest, we are asking recurrent any bug, chest pain and cough, endocrine, thyroid, Addison disease, blood sugar, diabetes mellitus. So Addison disease and thyroid, for thyroid we can ask like hot or cold intolerance, is there any lump in front of the neck? Addison's disease, are there any pigmentations, any skin color discoloration occur not, fatigue, weak feeling on diet. Then hematology, pallor, bruises, recurrent any bugs, any history of blood transfusion. So very important because the child Fanconi anemia is pale, bruises present, these are recurrent bug and history of blood transfusions. Then past history as usual 5T IOA. 5T IOA means any trauma, any treatment taking or not, any team involved or not, any blood transfusion history, any previous surgery, then previous any admissions needed for admissions, where it admissions like ICU or not, investigation what they did, any drugs, radiation, chemical exposure or not, we take. Parental history after that, difficult to feed, his pulse at birth, any concern regarding private areas, boys for hypospadias. Puberty in girls, important to ask if anyone talked to you about safe sex. And vaccination, any extra shots, especially for human papilloma virus, high risk of squamous cell carcinoma and vaginal carcinoma. Okay. And family and financial, social, psychological, as usual, we ask. The disease, how impact, we ask as usual. Well, so what are the degree of pancytopenia? Pancytopenia history if come, that is child is pale, we find that is aplastic anemia, radiation, chemical, viral infection, parvovirus. Aplastic anemia come on history, another history it comes. So aplastic anemia, radiation, chemical, viral infection, parvovirus, these are the DD of pancytopenia. Then DD of bleeding. In bleeding, the chief complaints DD, the local are trauma, any tumor, polyp and foreign body, and systemic are hypertension, vitamin K deficiency, that is Yaxi disease and Noonan syndrome. Then liver disease, leukemia, lymphoma, myeloproliferative disease, neuroblastoma, decreased platelet count and functions, coagulation defect, vascular VWD, aplastic anemia. These are the systemic DD of the bleeding. So this is Fanconi anemia history. It comes on Jeddah 2019. And our child has a problem, 5-year-old girl, Fanconi anemia with aplastic anemia and multiple bruises and failure to thrive. And child had learning difficulties and deafness. Family history and consanguinity positive. So when child bleeding disorders or pale or short stature comes, when we take the history, if we find the child is short stature, we find there is unusual features like absent thumb, hypoplastic thumb, then deafness present, loss at ear, deafness, failure to thrive, they will tell that not growing like other child. some renal abnormalities, then also features of aplastic anemia and acute myeloblastic leukemia, then it is Fanconi anemia. Thank you very much.